Hello, my name is Abiba Salahou, and I'm a third-year medical student at Oakland University William Beaumont School of Medicine. And today I will be presenting on a student-led medical education initiative titled Qualitative Assessment of Inclusivity and Ethnic Diversity within the Preclinical Medical Curriculum and the Implementation of a Student-Led Call to Action Task Force. So for a bit of background information, the surge of anti-racism initiatives in 2020 that was catalyzed by the murders of George Floyd and Breonna Taylor prompted medical students at OUWB to analyze the lack of ethnic representation within the school's medical curriculum. This ultimately led to the creation of a student-driven call to action initiative at OUWB, also known as the CTA. The purpose of the initiative was to, one, improve racial representation within the school's curriculum, two, advocate for the inclusion of different ethnic groups within all aspects of preclinical teaching, and three, to give students a platform to share their perception of racial inclusivity within their curriculum. So for a description, initially a group of medical students drafted the CTA proposal that included an analysis of the preclinical curriculum, as well as 8 core action items for the OUWB administration to address. Students specifically made recommendations to improve the representation of minority patients within the 9 core organ system courses covered within the curriculum, as well as 2 longitudinal public health and clinical skills courses. The students then formed a call to action task force committee in order to ensure that the OUWB administration was actively working on addressing the action items. Lastly, 1 year after the initial publication of the CTA, M2 students were surveyed in order to assess their perception of racial representation and diversity following the CTA initiative. So this is a bit more background on the CTA. The CTA ended up being much bigger than we ever imagined. The initial CTA sparked a lot of discussion within the OUWB community regarding representation and diversity. In addition, the CTA was also published within the Journal of Academic Medicine as a way to share our work with other medical students and encourage students at other institutions to consider the ways in which they can improve diversity at their school. Here are the 8 core action items. So for our outcomes, we collected a total of 245 signatures in support of the CTA and our 8 core action items. Almost 70% of the OUWB M2 medical students reported that they did not think that images of racially diverse skin tones and ethnically diverse case presentations were portrayed within their curriculum. Over 80% of the students did not feel that physical exam skills were taught on racially diverse skin tones. We also asked the students to provide open-ended feedback regarding their feelings towards racial inclusion within their school's curriculum. The most used words that students included within their feedback was disappointing, significant improvement, eczema, dark skin. For further outcomes, as a result of the CTA, we also saw changes in some of the preclinical organ system lectures. Following the CTA, all of the organ system courses updated the course syllabi in order to include a diversity statement. In addition to that, all of the course lectures included a new diversity statement. 4 of the 9 organ system courses specifically updated the course material in order to include new slides, as well as new lectures to reflect the proposed changes in the CTA. The Art and Practice Medicine course, where students learn clinical skills, was also updated in order to include more inclusive clinical vignettes. A group within the OUWB's curriculum committee was also established to oversee efforts. So to conclude, overall, the CTA initiative brought significant attention to the lack of racial representation within the OUWB preclinical curriculum and further ignited discussion on improving racial diversity within the medical student body. However, despite these changes, there still exists a significant amount of room for improvement, and there's still a lot of work that needs to be done to improve the ethnic representation within the OEWB curriculum. Thank you so much for taking the time to listen to this presentation. If you have any questions, feel free to email me